Hi there, and welcome to Group 9's presentation on cystic fibrosis. This presentation is by Anshika, Julia, Abdul, and Selassie. Our presentation will focus on an introduction to cystic fibrosis, some biological explanations, symptoms and lived experiences, treatment, and followed finally by applications to nursing practice. Let's begin with an introduction to cystic fibrosis. Cystic fibrosis is an inherited disease that is characterized by the buildup of thick and sticky mucus that can damage many of the organs of the body. Mucus is a slippery substance that lubricates and protects the lining of the airways, the digestive system, the reproductive system, and many other organs and tissues. Cystic fibrosis affects the cells that produce mucus, sweat, and digestive juices. The secreted fluids are normally thin and slippery so that it can perform its functions. However, in people with cystic fibrosis, the body produces secretions that are abnormally sticky and thick. Instead of acting as a lubricant, the secretions plug up tubes, ducts, and passages, especially in the lungs and pancreas. Over time, mucus buildup and infections can result in permanent lung damage, which includes the formation of scar tissue known as fibrosis and cysts in the lungs, as well as digestive problems such as a buildup of mucus in the pancreas and intestinal blockages, especially in babies. Next, we will be discussing a biological explanation of cystic fibrosis and what exactly causes this condition. Let's begin with a review on protein folding. As we were previously taught in lectures, proteins are a diverse group of macromolecules that are made up of amino acids, also known as polypeptide chains, and they play several crucial roles in the body. Proteins do most of the work in the cells and are required for the structure, function, and regulation of the body's tissue and organs. Proteins have 4 different levels of folding, all of which are important to its shape and structure. If it doesn't fold correctly to its shape, it won't be able to properly perform its function. In cystic fibrosis, there is a gene called the CFTR gene, which provides instructions for producing a protein called the cystic fibrosis transmembrane conductance regulator, and this is what misfolds. The CFTR protein is made up of 1,480 amino acids. Once the CFTR protein chain is made, it is then folded into a specific 3D quaternary shape, which is a polypeptide that contains 2 membrane-spanning domains, 2 nucleotide binding domains, and a regulatory domain. This protein functions as a channel across the membrane of the cells that produce mucus, sweat, saliva, tears, and digestive enzymes. This channel transports negatively charged particles that are called chloride ions into and out of the cells. Chloride is a component of sodium chloride, which is a component found in salt and sweat. Chloride also has important functions in the cells. For example, the flow of chloride ions helps control the movement of water in tissues, which is necessary for the production of thin and freely flowing mucus. More than 1,000 mutations in the CFTR gene have been identified in people with cystic fibrosis. Most of these mutations change single protein building blocks, which are the amino acids in the CFTR protein, or delete a small amount of DNA from the CFTR gene. The most common mutation is called delta 508, which is a deletion of one amino acid at position 508 in the CFTR protein. The resulting abnormal channel breaks down shortly after it's made, so it never reaches the cell membrane to transport the chloride ions. Disease-causing mutations in the CFTR gene alter the production, structure, or stability of the chloride channel. All of these changes prevent the channel from functioning properly, which further impairs the transport of chloride ions and the movement of water into and out of the cells. As a result, cells that line the passageways of the lungs, pancreas, and other organs produce mucus that is abnormally thick and sticky. The abnormal mucus obstructs the airways and glands, further leading to the characteristic signs and symptoms of cystic fibrosis. Let's move on to the symptoms of cystic fibrosis. The 2 systems that are predominantly affected by thick mucus, as they have large areas with mucous membranes, are the respiratory and digestive system. These 2 have predominant mucus functions. Signs and symptoms of CF can vary depending on the severity of the disease, but the disorder's most common signs and symptoms in the respiratory system include a persistent cough that produces mucus called sputum, wheezing, exercise intolerance, repeated lung infections, inflamed nasal passages or a stuffy nose, and recurrent sinusitis. In the GI system, foul smelling or greasy stools, poor weight gain and growth, and chronic or severe constipation can occur. There's also progressive damage to the respiratory system and chronic digestive system problems. Let's discuss treatment options for cystic fibrosis. It's important to know that there's no actual cure for cystic fibrosis. However, treatment can help ease the symptoms, reduce complications, and improve overall quality of life. Close monitoring, along with early and aggressive intervention, is recommended in order to slow the progression of cystic fibrosis, which could lead to a longer life. The goals of treatment include preventing and controlling the infection that occurs in the lungs, removing and loosening mucus from the lungs, treating and preventing intestinal blockage, and providing adequate nutrition. Medications such as antibiotics, anti-inflammatory drugs, stool softeners, acid-reducing drugs, and mucus-thinning drugs are a few options that doctors may choose from when prescribing medication for an individual with CF. Airway clearance techniques, also called chest physical therapy or CPT, has the ability to relieve mucus obstruction and helps reduce infection and inflammation in the airways. These techniques can loosen thick mucus in the lungs, which further make it easier to cough out. Lastly, for our final section of our presentation, we will be discussing the application to nursing practice and interventions. It's extremely critical that nurses promote the quality of life of individuals diagnosed with cystic fibrosis. First is recommending the physical exercise that may improve their condition. Since regular exercise helps loosen mucus in the airways and strengthens your heart, anything that gets you moving, including walking and biking, can help tremendously. Second is breathing techniques that may help loosen mucus and improve breathing. Huff coughing is the foundation of airway clearance techniques. It involves inhaling and then exhaling slowly and strongly. It is not as forceful as full-blown coughing, but may work better and be less tiring. A cycle of 4 to 5 huff coughs are usually combined with other ACTs. Third is nutritional counseling. Cystic fibrosis can cause malnourishment because the enzyme needed for digestion cannot reach your small intestine, which prevents food from being absorbed. People with CF may need a much higher number of daily calories in comparison to people without CF. Doctors may recommend supplemental high-calorie nutrition, special fat-soluble vitamins, extra fiber to prevent intestinal blockage, pancreatic enzyme capsules with every meal and snacks, and adequate water intake, including during hot weather. Nurses must keep track of the nutritional diets of their clients and encourage healthy eating. The fourth is counseling and support. Those diagnosed with cystic fibrosis may experience strong emotions such as depression, anxiety, fear, or anger. However, these issues may be more common in teens. It is important for nurses to be aware of these feelings and to allow their patients to confide in them about their struggles. Develop a deep nurse-client therapeutic relationship by actively listening to their concerns, promoting their well-being, and treating them as humans first rather than as a carrier of the disease. Introducing coping strategies such as journaling, joining support groups, etc., in order to help them understand the emotions they may be feeling is a really good strategy. And finally, education about their condition is important as well. Nurses must include their client in decisions made about them and allow them to be a part of the decision-making process. Nurses should take the opportunity to explain procedures and mechanisms when appropriate. And that concludes our presentation on cystic fibrosis. Thank you so much for listening. Hope you enjoyed.